Welcome back to the Pulse. Now, we know that Ghana is now recovering from the COVID-19 pandemic. However, it's a fact that this is not the first time we're facing such epidemics in the world, and countries such as Ghana have always had a challenge standing by and being prepared for another wave of such incidents. And definitely there's a need for us to assess our country's readiness for a possible outbreak of a pandemic again, because just as we speak, we're dealing with issues of monkeypox and some other viral infections which require the need for government to channel dedicated funds to support the country's preparedness. One of them has been the COVID-19 pandemic, where government has promised to set up some health emergency funds or systems in place that would always readily respond to some of these items. Have we done that so far, and how well are we supposed to manage such a system if indeed begins to roll out? Fortunately, the experts are joining me, and this is a very good time to start off with Dr. Emmanuel Eifa, who is the Deputy Country Director for SEND Ghana. Thank you so much, Doc, for your time. We'll be joined by Dr. Dacosta Abuaji, who is heading the National COVID-19 Task Force along the line. And also, the experts are here with us. Dr. Thomas Anaba is the Executive Director for the Africa Center for Health Policy Research and Analysis, and would also be joined by Dr. Enum as well, who would later tell us about the latest research they've done from the University of Health and Allied Sciences on the COVID-19 pandemic, and also will share his thoughts with us on how we can prepare for the next wave. But such a good time to be starting with you, Dr. Eifa. And obviously, as SEND Ghana, your interest has been about our systems and putting in place robust systems that will always ensure that we quickly come out from such pandemics, and also try as much as possible to prepare very well in terms of our structures. But let's start off from doing a little analysis of how we've managed the COVID-19 pandemic itself. From your perspective, would you say that government's systems, health systems, have been exposed by what we've seen so far?
I always tell people that you do not need a prophet to tell you that COVID actually really came to look at, not really looking at as COVID per se, but it unearthed some of the challenges that we had in our health system. But if you should track how other countries did it and what we did in Ghana, looking at the case fatalities and what happened, I think on the whole it wasn't bad. The only thing is that we were not prepared. And of course, nobody will prepare for emergencies. But we were not prepared because we didn't really put in place certain systems to make sure that in case of eventuality, health emergencies like we found ourselves in COVID, we were able to actually get a way out of it.
And some will say, well, we've missed that opportunity. It's fair enough to say we missed that opportunity. There were some faults here and there. But government is telling us, for instance, that they have some long-term plan where they'll be setting up, for instance, the emergency fund, for instance, which will go in to tackle some of these faults that we are beginning to witness. For you, looking at that long-term plan of government, the essence of the emergency response fund or whatever they would term it, do you feel that's a good strategy towards addressing some of these future occurrences?
In fact, this is something that SEND Ghana and our partner, Global Health Advocacy Indicator, and a host of other civil society have been advocating for. I mean, we were hit by double burden of COVID and also meningitis in 2020.
Right.
Before then, we were calling for the need to set up such a fund so that in case of any eventuality, the country would actually be up and doing. Right. And so the call for such a fund, we think that it is actually apt. Let me say that within the global context, this is not a call for only Ghana. US, as late as 1983, decided to set up such a fund. And in 2016, where we had outbreak of Ebola, even that didn't happen in the US, it happened in West Africa. That US decided that because they had set up such a fund, they voted as much as $5 billion
right,
just to support that. If you look at World Health Organization, they are calling on countries to do that. So even within Africa, there's a fund to be set up for such. And they are calling on countries to do it,
around
including Ghana.
Right.
What happens is that there's something called the International Health Regulation, which Ghana is a signatory to since 2005. as part of that, it also enjoins us as a country to make sure that we prevent and detect epidemics, and to make sure we put in place systems to make sure that it doesn't.
So for you, it's more about systems. Once we have the systems in place.
No, so I'm driving at
building a point about it, right?
So considering that, then Ghana decided to come up with what is called a strategy, the National Health Advocacy Strategy, to make sure in response to that. It's called the NAFS.
Okay.
So within that, what we have is that it has been costed based on the specific objectives. Unfortunately, although it has been costed from 2019 up to 2023, the current NAFS as we have, Action Plan for Health Security as you have it, it has been costed, but there is no funding for it. So the fact is, Ghana were even thinking about it before COVID hit us. Because we had it in 2019.
Just that we didn't make the...
Just that we didn't have that needed money
to support
that. And so this came as a wake-up call for us. And for that matter, when government decided in 2021, last year, to come out with what we call the COVID Health Act, the Act 2021, which would enjoin the country to put 1% of our taxes, like everything that is goods that are taxed,
we push it into
that fund. So we think as civil society, Ghana, we think that then it is an opportunity then to use a huge proportion of that money to fund future pandemics. And that is why we think that the Public Health Emergency Fund is a good idea that we should look.
We'll be coming to some more issues that we need to be on the lookout for. But let me bring in Dr. Thomas Anaba, for instance. Doc, you've been monitoring management of the pandemic and now government's response and the fact that we're even putting cost to it and trying to fund it. Are you, first of all, hopeful that this system that we are putting in place will indeed help us to respond quickly if we experience something similar to what we witnessed with the COVID-19 pandemic? Dr. Anaba, you'd have to unmute so we can hear the point you're making. Dr. Anaba, you'd have to unmute so we get the point you're making, so we understand your reactions to the concerns. Well, Dr. Herbert, if you're also there with us, the question about the whole system that we're creating now, do you feel that it's feasible enough? And you've done some research into this. Just yesterday, we were having a conversation with you on the issue of education and how people are not even fully aware of the dynamics of the pandemic. But in terms of the response mechanisms, are you satisfied about what we're hearing and how feasible it could be?
Right. Thank you very much for the question. Yes, the response that has been put in place by the system so far, we can only say it's laudable. But then when you put in a response and it doesn't resonate, it doesn't get to the grounds, then whatever you are doing is superficial. It doesn't really get to the grounds. And so the solution you are trying to seek would not become possible. And so the efforts should be targeted towards the population level, as we have continued to argue in our research recently published. So whichever effort is being put in place, we should just make sure that for it to make meaning to the average Ghanaian, we should be able to feel it. Like a Ghanaian would tell you, want to feel it in our pockets. Are we able to feel the effect? We might spend all the monies, all the dollars, the CDs on the interventions, but if the interventions do not get the requisite results, then I'm sorry, it's a waste of everybody's resources.
Where should we be placing that priority? Should it be much more about the fund or creating a system in a way that would ensure that at all times that fund is secured? We don't have government moving in to pick up some of the fund and use it for something else. That's also a challenge that could come up sometime in the future. We're not necessarily doubting government, but it could happen, looking at what's happened to other forms of funding.
Sure, funding is essential because whatever intervention you seek to put in place, you need the funds for that. But of course, I also agree with you that there have been reports in the past where funds set up for some of these things, questions came up, and so people had to be called to answer for some of those spending of the funds. And so yes, the funding is good, but then the intervention, what it's put to, the use that we put the funding to is essential. So I would recommend the two are essential. It's about how we manage it. Human resource management is key in trying to get all the solutions we want for our problems as a country.
And I guess it's a good time also to try Dr. Anaba once more to find out his thoughts on, well, we'll definitely try and get back to Dr. Anaba shortly on their policy perspective, because they seem to have done some works on and recommendations on this. But Dr. Ifa is also with us, and just as we've heard from Dr. Herbert, the point about feeling the effect and making sure that we secure the systems. Sometimes the system is stifled where you have funds going in for a certain purpose, and you find government through some policy measures redirecting or channeling the funds into other forms of deployment. For you, how do we ensure that, for instance, this system that we're putting up to ensure our pandemic preparedness, we do not end up dipping our hands into that coffers and using it for something else?
In fact, that has been one of our key advocacy lines.
Right.
The fact is that if you look into our budgets, there is no specific budget line item that is looking at pandemics, that is looking at health emergencies. It is always subsumed under the goods and services budget. And that is the fear of Send Ghana and our partners.
So mostly we just give it a heading, right? The heading is vague. Is it that the heading is vague, or what normally comes for the challenge?
It is actually vague.
Right, okay.
If you look into the health budget, there's nothing like any budget line item to cater for epidemics,
right.
I mean, let me even go back and talk about immunization. We've been working on immunization all these years. We realized there is no dedicated budget line for that. And so in most instances, you go to the Ministry of Health or Ghana Health Service, and they are challenged because as much as the budget as we have for health, you might want to be specific that we need so much money for that. Epidemics will be competing for other, because goods and services is not just for only epidemics alone. And that is why we say, yes, it's a nice idea to actually have the public health emergency fund. If as much as we projected last year, government projected as much as 144 million from the COVID levy. But for the first 3 quarters, we had about 364 million. And this year, we've been projected to have about 1.1 billion cedis out of it. And what we are saying is that if such money, a proportion of it is solely set aside for epidemic or pandemic or health emergency preparedness, that would be better than just making a blanket, and for that matter, it's subsumed under general goods and service, and you cannot really go into it and say that this is something that we can use exactly for this purpose. And as much as for that is what we are calling for, for a clear line item in the budget.
But then there's the issue about transparency. At least if we know how the disbursement is done, or perhaps what mechanism government is stating expressly in whatever document it is, we'll be able to track it. So transparency should be of concern to our society.
In fact, it is because of transparency that we are, first of all, calling for a specific budget line item. Because if that is there, then you can track it. But if it's not there and it's subsumed under goods and services, and you really want to account for, I mean, we call it COVID-19 health levy. And COVID, it's an epidemic.
Right.
And so it's important that we have that. Because in the bio, you see, in terms of receipts, you see it, COVID-19 health levy. But when you come to the other side of the equation,
then it's subsumed into goods and...
So aside that, another issue about transparency is about who manages it.
Okay.
We believe that this shouldn't be one of the funds that we think that political element
should be the one in charge of this. Because when the pandemic came, of course, there was this ad hoc arrangement by Jubilee House to have some management in terms of a trust fund to receive money from the general public. Do you want such a same approach to be applied to, for instance, this fund, or you want a completely new setup or you want to use the Ghana Health Service? What's the best approach?
So, one, I wouldn't fault government at the very instance, because what happens is that sometimes in times of crisis, you need quick ways of doing things. I believe that is how come they quickly set it up at the top level. But I mean, over time, we're expecting that government could have probably handed over to an independent, non-political institution
to manage
that. So that's what I'm saying.
Why is that crucial anyway? Is it that you doubt the political appointees?
Crucial because I mean the point is normally what happens is if you are politically appointed, you fall the harms and caprices of whoever appointed you, whims and caprices, and that is what we want to avoid. We live in a country where if it's an issue of one is set with whichever political appointee, you realize that you might even go into other things. We are hearing...
but I guess in the end, the political authority may be that final person to give the go-ahead, even if you have an independent body managing the funds, for instance.
Yes, we were just last week, or this week, the Minister for Finance was in Parliament. We spoke about this COVID expenditures. And whilst we were calling for, people were calling for the fact that there are still some gaps, they should come and explain. What we are hearing is that some portions are meant totally not in the purview of the Minister of Finance, but for
other
agencies.
Right.
And one clear agency is what was set up by the Office of the President, that the COVID alleviation fund that everybody was supposed to contribute to. So we wouldn't want such a situation to happen. That's why we said that let it be devoid of political element. Ghana Health Service has the capacity
and the
to
personnel,
manage that because there is a EPI division. We have various divisions within Ghana Health Service that can manage. They are technical people, and so we believe that that could be done.
But there's even the question about how long, when next we'll be expecting another pandemic. I mean, it may sound as a very, funny question, but then obviously we should be prepared. But we need to know perhaps what's the estimation. Let's bring in Dr. Herbert again. Dr. Herbert, from your side, and you've done the recent study into that. So looking at the trend and the trajectory, are we able to really predict when next we may have, say, another contagion? I'm not an expert, so correct me if I'm wrong, that perhaps you, the experts, are able to tell.
Okay, thank you very much. So, yes, as you rightly mentioned, looking at the trends of COVID, for instance, you realize up until sometime March, the trends were very low, prevalence rates were very low. Then from March to the end of May, then we started to have an upsurge of the cases again. And so, yes, we might have another serious situation on our hands if we are not able to holistically address it through all the interventions that we need to put in place by government, by international agencies that provide donor funding to us, by the media, by other well-meaning Ghanaians. The president will tell us we should be citizens and not spectators. So this is the time that we all have to contribute our bit in ensuring that we do not get to the point where people are scared of coming out of their homes.
Right, but in the context of general preparedness in terms of epidemics, would you say that, for instance, if we have funding targeted at preventive measures, that could also be another way of slowing down the rate of such effects then?
Yes, emergency preparedness, preventive measures is one major challenge, I would say, we have as a country. Yes, I agree that we have done our bit in ensuring that we do not have serious situations on our hands. But in terms of public health preparedness, there's always been a challenge there. We wait typically of us for the problem to come before we rush to address it. Systems are usually not robustly and effectively in place so that once there is an epidemic, which then of course spirals into a pandemic, we are able to effectively deal with. So public health preparedness, I can confidently say that has usually been a challenge for us.
Okay, and within the Ghana Health Service, for instance, would you say that if we have, for instance, adequate allocation of the funds, they would be in a better position to handle our preparedness?
Of course, yes, we can make the funding available. That is one step of the way.
Right.
It is how the funds are also managed that will take us to the point where we are able to address the situation. What if the funds are made available and then a few, for want of a better word, greedy bastards embezzle the funds? It means that, yes, you have made the funds available, but the intended purpose for which they have been made will not be put to use. So, yes, we have to make the funds available, but then, as I mentioned about the human resource situation, people should be in place to ensure that we are able to manage the funds judiciously. Because if we don't utilize it well, then of course it becomes a waste. And the
so let's use the recent COVID-19 situation as an example, looking at what we've heard from the finance minister and the various details that are coming up. Would you say that there's been some gaps in terms of how we've gone ahead to handle this epidemic, for instance?
Okay, thank you very much. Yes, there's been a gap, but I wouldn't blame the government apparatus entirely for this. This is a pandemic that wreaks havoc on everybody, irrespective of whether you are a government official or you are a private individual somewhere. Like I mentioned in my discussion yesterday, we all went back to sleep when it was as though the pandemic had at least receded a bit. So we all went back to sleep. Funding was cut short. People were no longer wearing nose masks. Many of us have not even yet vaccinated. And so everybody went back to sleep. And so it's a collective effort by all. And of course, government would have to play a key role in this, but it behoves all of us as citizens to also play our bit to ensure that we do not have a situation that we will not be able to handle in the nearby future.
Raising another, concern about the human resource aspect as well. How do we connect that to, for instance, the judicious use of our funding?
Of course, it's about putting in mechanisms that create for transparency. Transparency in the management of funds that are earmarked for the fight against COVID-19 and any other epidemic that we might experience in the future. Yes, we can set up the funds, but if we do not have trustworthy people, that's my word, trustworthiness is key. If we don't have the people in place and they are able to account for every pesewa that is spent, then it would be like pouring water into a basket and the result will never be yielded.
Earlier, when this came up, of course, we saw the establishment of the COVID-19 Trust Fund, which was receiving contributions from the general public. The concern is, let's continue in that habit in terms of our epidemic preparedness, where we could create a constant platform for people to always give out if they can, or to support government. Would you say that citizen participation in terms of our epidemic preparedness is very much necessary?
Thank you very much for the question. Of course, for a nation to grow, we all have to play our part. But for the private individual like myself to give out some of my salary at the end of the month to put into a fund to address pandemic or epidemic preparedness, then I need to be assured by the systems that are managing the funds that my money will be put to good use. If I cannot guarantee that, then I would not be willing to let go of my hard-earned money, which, of course, as labor, we already complain that it's not sufficient to keep us with our daily activities. And so, of course, yes, we have to support our citizens. And then I will repeat the president's assertion again: we have to be citizens and not onlookers. And so, of course, we have to participate. We need to be sure that we are getting value for our money.
Interesting points you're raising there. In fact, Dr. Thomas Anaba will be joining us shortly. It appears that we've lost him briefly, but they have an interesting take on this. But Doc, it brings us back to the issue of the systems. And for instance, there you have Dr. Huber talking about the fact that transparency. Is that the only solution to the problem? Because even if we are told that this is how much you're spending on it, it does not necessarily deal with the issue of proper allocation. I guess that which of this should be paramount for us? Transparency or the proper allocation?
I think there's something called necessary condition, and then there's a sufficient condition in economics. So the necessary condition is to set up the fund, have a clear budget line. And in fact, let me just add, the importance of doing that is, like you said, in terms of human resource, you get the people in case there are emergencies. We need to set up labs. We need money. Right. When COVID hit us, we only had two, Noguchi and KCCR. Yeah. It was later that we expanded on. Aside laboratories, we need certain other logistics. So that is a necessary condition. The sufficient then condition will be after having that clear budget line, making sure that it is actually utilized for the intended purpose. Of course, that's where the transparency issues come in. And that is where we are calling for the fact that let the technical people handle an independent body handle that. I believe that when that is done, that is going to really help.
And even before that happens, of course, the likes of St. Ghana and other civil society organizations would have to make government aware of this. You've been engaging government on a series of issues concerning our national budget, for instance. What further measures are you going to put in place, for instance, to inch us closer and closer to this objective that experts are even calling for?
Okay, so currently what we are doing is that, just as we are speaking here, we are also trying to petition government, parliament, and then the head of state, just so that they will know that, yes, Ghanaians and civil society...
Oh, that's how far you want to go with this?
We also buy into the idea. So we are sending a petition for government to consider that very seriously. Just this week, I was in Ministry of Finance. We had some discussion on what is called our open budget survey. And in that, we threw in such an idea. Watching the minister was in there because at the same time we were having the meeting, he was in Parliament
rendering some account.
Exactly, the account. But that is discussion that we would have still with the Ministry of Finance, Ghana Health Service, and with all interested parties to make sure that that is done. Because when we do it for Ghana, considering the adverse impact of not acting. When COVID hit us, our economy was projected to grow by 6 to 7% by the World Bank. Because of COVID, it came down to 2%. And look at the huge mortality that we find ourselves in during that time. So it's better for us to act now. Let me just add this quickly. In terms of the argument about where we'll get the money, we think that we are not looking at just the COVID levy of 1%. And that one, everybody pays. My brother was talking about why not Ghanaians who want to pay. We did a study, that wasn't St. Ghana, but I and some other person did a study, look at people's willingness to pay, to contribute to kind of a fund. We did individuals and we had what we call altruistic willingness to pay. To what extent, if you are not affected, you pay.
How willing are you?
And people were willing to pay, but the only fact is that they want to see that.
the same point Dr. Hubert was raising. For now, would the money be judiciously used? I guess that's the paramount concern.
The fact is that now every Ghanaian, so far as you are buying something, you are paying for, because the COVID levy is on goods and services. So all of us, to some extent, are contributing. Aside that, we had some stakeholder meeting last year. This one was SEND and our partners. And nice contributions came in. Other people thought that, one, it's important to take a look at the District Assembly Common Fund. Although there are challenges.
So that we could decentralize the system, make the money go to the base.
When COVID hit, everything was centralized initially. The district, they had difficulties in getting money. And so the main issue is about time we look at even at the local level, the Additional Assembly Common Fund, the formula could be looked at so that some little percentage, although we know that it's not coming, it's not common anymore, but some little percentage could be geared towards at the district level.
Right.
Just like the way we have the national level fund, some district level fund, just so to cater for that. We are also suggesting that hospitals generate internal revenue
by themselves.
By themselves. Right. So some little percent, because the fact is when these things happen at the district level, it hits hard the district as well. They are, the hospital, they are overstretched. Yeah. And so now that we don't have such a situation, some little amount of their internally generated funds,
try and dedicate that
to something. But that will be managed at the district level.
Right.
And then when that happens, of course, they can use it. The last way,
and I guess that's why we need that independent structure as you're calling for,
exactly.
to just administer all of these funds. Yeah. But would the money be sustainable? That I guess that's another concern.
Yes, but you see, it's always we should just start from somewhere. I gave the U.S. example. Right. In 1983, it became dormant at some point. Then somebody decided to petition Parliament in the U.S. They call the Rosa Bill. Right. That let's try to put in $5 billion US dollars for that, just to activate it. And through that, we have people contributing. So one is starting it. When last 2 years, when government set up the COVID fund, we had individual contributing. The private sector fund, people contribute. That's where we saw the nice edifice that was put up by the private sector. So people, I'm sure, are willing to contribute because we know that when pandemics hit, it hit all of us. And so I'm very sure that businesses, private sector, everybody would want to contribute. But of course, there should be systems in place to make sure that it is used for the intended purpose.
And I'm hoping that Dr. Thomas Anaba will share his thoughts with us. But Dr. Herbert, if you're there with us, what's interesting is that, for instance, during the peak of the COVID-19 pandemic, we saw a situation where some nurses were complaining about, for instance, their insurance package is not being giving them. And it brings up the issue about priority setting and how sometimes the political class may not be necessarily focused on the health practitioners. So is that perhaps justifying the need for us to have independent hands trying to deal with these funds?
Of course. It has to do with what we call evaluation, for instance, when we do our research. If you are a researcher and then you conduct research and you are the same person evaluating the effectiveness and whether the set objectives have been met, of course, you are not going to do any good work because of the subjectivity that you would be having when you are perusing what you have done. So, of course, there's the need for independent hands that look at the issue from an off point of view where they are not really concerned whether there's, for instance, a case of mismanagement realized or not. Once we have that, then whoever is giving out the funds, making sure that it is utilized for the preparedness we are all talking about, would be cautious in how the funds are spent. Otherwise, then there's a challenge.
So as we wrap up on this conversation, for you, what should the future be looking like and what should be our focus as a nation?
All right. I subscribe to the setup of Epidemic Preparedness Fund, yes. But then I also subscribe to the call for citizens to support in this setup. But then, of course, I also argue for the position where we would ensure that whatever funds are put in place, tomorrow we do not get up and want to use those funds for other things. There are times where we even hear about some of our funds. There are requests that they want to use these funds for things totally away from the purposes for which we have set those funds up. So yes, we can set up the funds, but we need to ensure that there's goodwill on the part of the people through the actions of the managers of those funds. And I'm sure once those things are put in place, everybody will be confident and contribute their quota as citizens. to the support. Then, of course, we are saying that with COVID-19, it seems to have come to stay with us. But then, if we do not get our house in order, we are going to have a challenge on our hands.
Is this even the time to expand the classification and make it more broader in that sense? Because when we talk about COVID, some say, well, there are variants, and then we know that more and more forms of this viral diseases will come up. Tell us about the science of it and whether or not we could expand the classification of that COVID situation or the disease itself.
Please come again.
Yeah, in terms of the classification of the disease, but we are seeing various types as well. Some are saying that, well, there's a technical name for it. We've had SARS-2 and some other descriptions. So is this the time to reclassify and expand that scope within which we can just look at the COVID as a disease? It appears we've lost Dr. Hubert there, but Dr. Eva, you're with us. Perhaps you have an interesting thoughts on that as well.
Well, I'm not,
you may not be the doctor here.
But what I would say in relation to that is,
right.
You know, COVID is just one of the many
right.
Of such viral diseases. We just woke up last 3 weeks or so, we heard about monkeypox.
Right.
Before that, we used to have meningitis.
And all of that.
And all that.
No one knows what will happen next.
Yes, in fact, in the next 1 second, you never know what will come.
Yeah.
And so for us, it's important. But let me add something.
Right.
I think he made a good point about looking at a public health emergency fund. The fund will be there, but, and I will repeat, our fear is that it shouldn't be that we set up the fund, that is all. We need a clear budget line item. And every year, the Ministry of Finance come out with budget guidelines to guide all department agencies in preparing their budget. And as part of that, if the ministry have a specific guideline to say that so much should be earmarked specifically for epidemics, for pandemic preparedness, we think that that will be the way to go. So just to add to the fact that, yes, we are calling for the fund, the public health emergency. We are not calling it for COVID fund. Right. Because COVID is not the only public health emergency. We used to have cholera, which was killing a lot of people. We have a lot of such emergency, health emergencies. And globally, in fact, what organizations don't call it COVID, they call it public health emergency fund. The Africa CDC call it same. And so,
because they know definitely some other items or, diseases may come up. So just as we wrap up, I'm interested finally on the issue of the petition that you're sending to, or you have sent. Have you sent them already?
No, we are now collecting.
Yeah, collecting some. Tell us about that and what we are to expect in the coming days on that.
So it's exactly the point that I just made, that we are telling government that the fund, public health emergency fund, is critical. It's critical for our very survival. However, we really want government to have a specific budget line item so that it should not be subsumed under the goods and services budget, so that we can hold government and whoever is accountable that so much money has been dedicated for epidemics, for pandemics.
So you're sending this to, for instance, Parliament and then...
Yes, Parliament...
So are you demanding the same thing from these two organizations?
Yes, because the fact is that whatever the Ministry of Finance wants to do, we need approval from Parliament. And if the act, let me look at the COVID Health Recovery Act, it has to go to Parliament to pass it, and the President needed to assent to it. And so that it's important that we don't look at just one side. So we are calling on Parliament, we call on the Ministry of Finance, we call on the Presidency, and of course we call on those at the local level, because the fact is that if it's passed, they are the ones that are going to implement the operation.
Is there any part of, for instance, the documents you're talking about that we could really check just to achieve this target? If we insert that clause, perhaps in these documents that you are talking about, would they achieve this target? Do they have the potential?
Yes. So once that is approved, you know, there's a budget calendar. Now we are in the media budget. I'm sure by law. By the end of July, the Minister of Finance is supposed to come and deliver the media budget.
Right.
So we have calendar like that. So after that, they'll be calling for input into the budget. And these are some of the things, the suggestions that we want to put forward.
Right.
And once that is there, we believe that the ministry will take it up. And when the ministry takes it up and is inserted in the budget, I believe Ghanaians are going to be the winners. We also have a hashtag Fund Epidemic Preparedness GH,
right,
just to support such a call. So we are calling on everybody
right,
to at least support the idea, especially the president. Mr. President, you are listening.
Definitely. I was just about to give you that opportunity that quite a lot of people are watching. So what would be your message to the authorities then?
The message is, if Mr. President is listening or watching, or anybody who is watching us, we are saying that it's about time that the Public Health Emergency Fund that has been promised to set up, we put it into action. It's also about time that we have a specific budget line to take care of epidemic preparedness. And by doing that means that the National Action Plan for Health Security that have been costed and unfortunately we don't have money for, I believe that we'll have money to fund that. So that in the next 1 second, if we are hit by another eventuality, health emergency, we wouldn't be found wanting. We had to go to the World Bank to get money, and those money were not freebies. We will pay. If you look into the Ministry of Finance website, I don't know which, I think the 150 million or so.
The rapid,
exactly,
yeah, credit facility that we went for, right,
for 30 years. And I believe the IMF 1 billion and all those
will also add up to that.
Add up. If we had such a fund, we wouldn't have gone to them. If even we had done so, probably wouldn't have been so huge. Something that we are going to pay for. But let's begin now. Little drops of water makes a mighty ocean. When we put in the money and people realize that yes, it will be used for the intended purpose, I believe that they would be also contributing to it. There's one thing that we try to look at, but I've not researched into deeply. National lotteries. We are thinking that
you feel that should be, if you once you going to stake, something should be deducted.
I mean, yes, but not even that per se.
Right.
Maybe, they also need money for their operational costs.
Right.
And then after, they need to pay people who have won and all that. So they could decide that maybe set aside one month, deducting their operational costs and winning bonuses. And maybe just that could be.
That would be a very interesting move.
Just to support.
A lot of people are not looking in that direction, but probably we should.
I don't know how much they earn though, but that could be because lottery is also part of they are being featured. You are just taking
and predicting.
Yes, it's more about risk. And pandemics also put us into risky situations. So we could also, if the Director General for Lottery, National Lottery is watching.
Yes, I mean that's an aspect.
We could also think about.
I'm sure probably the Finance Ministry is even tapping into your idea on this one. But
think about
anyway,
something like that.
But Doc, it's been wonderful having you in studio, and thank you so much for joining us here on the Pulse. And thanks for staying with us.